and the connection between public and active transport, livability and health. I'm Robin Goodman, and as of this week, I'm Emeritus Professor of Urban Planning at RMIT, and I'll be hosting the program today. I realise that many of us are on different locations at present as we're meeting virtually, but I would like to begin by acknowledging the people of the Woi Wurrung and Boon Wurrung language groups of the Eastern Kulin Nation, on whose unceded lands the city campus of RMIT University sits, and we respectfully acknowledge their ancestors and elders, past and present. RMIT also acknowledges the traditional custodians and their ancestors of the lands and waters across Australia, wherever we conduct our business and wherever you are located today. I should say at the outset that we'll be recording the program today, so be aware of that. If you're asking questions or commenting, you'll be recorded for posterity. The program for the next couple of hours this afternoon is to present some of the work of 3 separate but related research projects from RMIT's Centre for Urban Research around our work on sustainable transport and impacts on health. This event and these projects are supported by the Urban Futures Enabling Capability platform within RMIT. The 3 projects we're going to hear from are firstly the early delivery of equitable and healthy transport options in new suburbs, presented by Annette Krohn, health impact assessments, presented by Lucy Gunn, and then the Australian Urban Observatory, presented by Melanie Davin. So each of these presenters will talk for about 20 minutes, allowing about 10 minutes for questions after each. You can either raise your hand when it comes time or pop your questions into the chat and I'll read them out. And if all that goes according to plan, hopefully it'll give us about 15 or 20 minutes at the end for further discussion and Q&A to round them out and get the different presenters to respond to general themes. So if that's all clear to everybody, as usual, keep your microphones muted if you're not talking or being called upon to ask a question. And if you're not speaking, keep your camera off. So first of all, I'll hand over to Annette Krohn, who's going to kick us off and share her screen. Annette.
Okay, thanks, Robin. I'll try to share. Can you see something? Yeah, I think you can.
Yes.
Good. And just need to swap something so I can somehow look into the camera. Okay, so I'll actually move those slides to this presentation. So yeah, thanks everyone for coming. And I also would like to acknowledge the Wurundjeri people of the Kulin Nation on whose unceded land I work and live, and pay respect to their ancestors and elders past and present. And as Robin just said, so today I'll present on the project on early delivery of equitable and healthy transport options in new suburbs. And apologies to those who came or were at the webinar last week as well. The first few slides will be a bit similar, given that I'm introducing the project, but I've tried to focus on a different part of the project this week, this time, well, especially on local government issues, of course, so which would be interesting for you. So just, yeah, as an introduction, really this little story which ran on ABC last year, which was about someone living in Tarneed, so in one of the growth suburbs that we are looking at, and having what they call a ghost bus stop outside his house. So this is really about what we are looking at in a way. So the high levels of population growth are putting pressure on housing and infrastructure development, especially in growth areas. And often public and active transport infrastructure and services are the last to be delivered, impacting on the behaviors and health of residents in those suburbs. So this is what we are looking at with the project, and trying to find ways where, well, how you can deliver those transport options early. And with transport options, we are mainly looking at public transport and active transport, so walking and cycling. Quickly, so our project partners are the Victorian Planning Authority, Stockland as a developer, City of Casey, City of Wyndham, Department of Transport and Planning Institute of Australia. And as Robert mentioned, the project is funded by RMIT's Urban Futures Enabling Capabilities platform and partner organizations as well. The project team, most of them are there today, but there are a few others also involved in the project. And we have mainly three main research approaches. So policy analysis, we've done a resident survey and interviews in growth areas. And then we've also looked at, well, the actual outcomes in growth suburbs, but also at transport scenarios of early delivery and looking at the costs and benefits and actually funding approaches. I tried to talk a little bit about all of them, but the main focus today is on the survey and interviews. But before I start with that, I want to come back to the ongoing work, the scenarios for the early delivery of transport options. So what we are doing, well, looking at early delivery, how would that happen? What would that mean in 2 case study areas, and calculate the costs and benefits. And as it is ongoing work, we can't really say any numbers yet, but we are hoping to finish that work early next year. So hopefully can then publish something on that. And what I just want to say, so that work is really looking at these questions. So to what extent is earlier delivery better and why? What are the benefits? So trying to put numbers on that. And then also knowing how much more expensive is earlier delivery actually, and which infrastructure makes a lot of difference, and to what extent would sequencing of growth make a difference in that as well. So just wanted to highlight that this is something that we are still doing. And then just the brief version of travel behavior and benefits. I think for one, most of you are probably aware who are here today. But why we are looking at early delivery is really that life change events, and that could, for example, be moving, are a catalyst for change. So if you're moving somewhere, you're more likely to change your behavior because everything else in your life is already upset in that sense. So you might as well change other things. So if there are available transport options, if they are already there, you're more likely to change them than if they come later. That's not to say that if a new bus route, for example, is put in 5 years after you've moved, you won't use it. It's just that there is a higher likelihood when it's already there when you move. And that's the so-called window of opportunity. Benefits. Yeah, I think I don't need to say too much about those today. I think probably most of you are aware of that. Less congestion, fewer greenhouse gas emissions, health benefits. Actually, Lucy will say quite a bit about that after this talk, so I don't need to go into detail of that. And then we are also looking at social, economic, and economic participation through new trip opportunities for non-drivers, so through the transport options. But now I'll go to the resident survey and interviews. And so we have done a survey in 2 master planned estates in Wyndham and Casey. As our case studies, the survey was from April to June last year, and the interviews were done from October to December last year, talking to 30 residents overall, 15 in each case study. And what I'll be looking at today is mainly the active transport experience, in a way, because this is something where local government actually has an influence, whereas public transport is a bit more difficult. And first of all, you can say that the quality of foot and cycle path is actually quite high in Melbourne's new growth areas, so in the so-called precinct structure plan areas. But this is different in somewhat older areas, so the standards haven't been that high when they were implemented. But if you look at the newer areas, it's actually quite good within the area. But then there is a disconnect between different areas, and while paths are good within suburb, it's sometimes difficult to get to other areas. And you can actually see that, for example, in the difference between walking for transport and walking for leisure. So these are case studies, and as you can see, walking for transport is around, well, 18 and 25 minutes, whereas walking for recreation or leisure is actually at, well, a bit more than 2 hours in Allura and a bit under 2 hours in Selendra. So people are walking a lot more for leisure than for transport. And this is actually so that walking for transport is in comparison to other areas is relatively low as well, and that's other growth areas as well, whereas the walking for leisure is really quite high in comparison. Then you can see that residents actually walk to destinations if they exist, and not all of them all the time, but to some extent. So we have some quotes here about the foot and cycle path connection. One quote is, I mean, I can't even get over to the cafe over the road with a pram. It's just too dangerous. There's nothing there. It's not safe enough to go across, so I don't do it. So that's the disconnection this person is talking about. And the other two quotes are about that there are often few destinations at the beginning when people move in. So where do I walk to? That's the question. What do I walk for? The nearest Woolies is 3.5 kilometers away. And the paths here, yeah, they're great path, but they don't lead anywhere. So they advertise 5 kilometers of cycle path, but where do they go? So in a way, you can see people enjoy the walk, foot and cycle path, but if they want to go somewhere, it is a bit difficult. And in our case studies, there was actually an interesting difference in that Cilindra Rise has a little town center with a supermarket, cafes, takeaway, and a community hub, while in Aurora, the planned town center hasn't been built yet. So the school and childcare center are built, but no supermarket or cafes or anything. So, and in the survey and also in the interviews, residents in Cilindra reported actually walking to the shops. Residents in Aurora, well, we had one person actually walking to the shops, but there was someone who wasn't actually able to drive. Most of the others actually mentioned that they now shop once per week, rather more often to avoid traveling. So you can see that this availability of a town center really impacts on their, shopping behavior and in that sense, travel behavior as well. So I've two more quotes here. The first one is really from someone who moved from another growth area and was very happy that now he lives 2 minutes away from a Woolies and can just walk there. Whereas then in the Aurora example, someone says that they are only going at the weekend because otherwise it would just take too long to go shopping. Another importance for active transport that came out in the interviews is really the importance of, I've called them shortcut connections. So this one is about bridges over creeks. So there are 3 bridges to be built across the creeks for footpath that have not been done, which means to get to certain places, you've got to walk longer than if the bridge was built. But I found some shortcuts across the creek, which other people have as well. Why waste an extra 5 to 10 minutes going a long way around when you go through where there should be a shortcut? So I just thought this example really showed how important for walking it is to save 5 to 10 minutes and how important it is for people to actually then have the possibility or using the possibility to walk. And if there is not a shortcut, they might just not walk. Again, this was a person who in a way has to walk because they can't drive. And the last point is just, I want to mention that community hubs are really an important meeting point, and that again came out in the Cilindra Rise case study where there was a community hub quite early and people really like that hub. So as a first conclusion from those interviews and with regard to active transport, so you can say there is a high quality local active transport provision in the suburbs, but there is the lack of connectivity to other areas and destinations. And then at the same time, you have the backlog in other areas, which we didn't look at in detail, but it's definitely there. And you could say that there is actually not just the need for early delivery of transport options, but actually the need for the delivery of at least partly an early implementation of town centers. So for example, a mix of community hub, cafe and shop. And of course, there can't be a whole town center be built right at the beginning, but just at least having some destinations can already help for active transport and community. And this could happen in cooperation between developers and local government. The importance of bottleneck infrastructure, such as bridges, the bridges of the creek, but that's not only true for active transport, that's actually also really important for public transport. If the last few meters to the bigger road are not built, the bus can't get through there. So it's really important to concentrate on this bottleneck infrastructure at the beginning. And the last 2 points that bit smaller points. So wayfinding for destinations and shortcuts. So that person who said that their Woolies was too far away to walk, actually another person in that same neighborhood was walking to the supermarket, but because they had found the shortcuts themselves, so they were like, okay, I know where I have to go through which suburb. But if people don't make the effort to look for that, they might rather drive. So if you have some wayfinding, people might be more encouraged to walk. And the last two things are more just something like cycling classes for residents. And that's an idea from a previous project in Germany where I walked, where they actually did cycling classes for migrant women who had never cycled before and just were afraid to do it. And through the cycling classes, yeah, possibilities opened up for them to move around in with another transport mode. And the walking bus to school, I'm aware that actually quite a few communities already do that, but it could again be an option to have a bit less of traffic chaos around the schools and maybe pick up kids a bit away from the school. And the next two things I want to talk about, I really want to touch briefly on because I just don't have the time to actually talk about it in a lot of detail, but I still wanted to touch on it. And well, we have done briefing papers on the different topics in our project. So if you're interested in any of those papers, just let me know, and we are happy to send them out. And yeah, so because as I said, no, that will be brief. So this is the growth area planning dilemmas, trade-offs, and issues. And that was really when we looked at the precinct structure planning process in Melbourne. A few of the points that came up, and I've tried to focus on the one which are interesting for local government here. And one thing is the sequencing of development, which in a way helps to actually, well, for example, to build a town center. If you have a lot of people in one area, it's easier to build a town center or to build public transport. And also if state government actually commits to a certain sequence of development, local government knows what comes and can actually match this sequence of development. So in that sense, it would be very helpful. But the dilemma or trade-off here is that it goes in a way versus market logic or development rights. So you can't really tell one developer to wait until a certain area is finished, because if that developer in that area doesn't move on, it gets a bit hard. So there are, of course, ways, but just want to highlight the trade-offs and issues. And then you have the reluctance to commit publicly towards infrastructure from the state, which also goes, at least at the moment in Melbourne, against this sequencing of growth. The other point is, I've talked a lot about active transport now, but public transport planning is determined by state budget processes. So there's actually quite a good planning process for public transport with the precinct structure plans. But the actual implementation then is determined by a state budget process. So it's really the question, when will those buses come? So that's a bit of an issue again. And as I said, we've talked a bit more about that in the briefing papers. The other thing is really the network versus coverage in public transport. And that is really this question, should we have a bus which goes directly, like a shuttle bus, more to the train station? Should we have a good coverage? And that's maybe something actually, again, where local government can come in with community transport to complement the other public transport network. But of course, this requires a lot of coordination as well. Then two short points: getting infrastructure contributions right. Again, I probably don't need to tell you that that's difficult, although again, the process has developed a bit in Melbourne and it is a bit easier now, but it hasn't been tested that much yet. And then introducing new standards into already gazetted plans or already built areas. And that's the backlogs I was talking about before, where you actually have a good standard in one area, for example, for a cycle path, but then the next area comes and it has a different standard. So this is something where the backlog really needs to be well caught up with. And then, as I said, just quickly, and I won't talk a lot about this table, but we have looked at funding options, and to actually finance the early delivery of transport options because, well, it costs money. So how can you actually raise that money? Because that's the main issue usually, that you don't have money to put that in. And a large part of these analyzed funding sources are on a state level. So again, that might not be as interesting for local government, but for the local government are probably interesting, the local infrastructure contributions, of course, but to some extent also the state infrastructure contributions, so the GAIC here in Melbourne. And parking charges are also something which could be undertaken on a local government level. So I'll come to the conclusions part 2. There are opportunities of temporary services and structures. So as I talked about the partial delivery of a town center, but maybe there's also an option for a partial delivery of a smaller bus fleet, a temporary bus. And I know that usually transport planners don't like that, to put in a temporary bus, because people don't like it when it's gone again. But I think there's still some merit in actually providing some transport options through that, and by making it really clear that it's temporary, this could also work. I mean, in a way, it's similar to the developer buses, which are sometimes put in at the moment as little shuttle buses. There is a need for flexible social infrastructure, and I actually didn't really talk that much about that, but that's in that sense, at the moment in the growth areas, you provide for families, but of course, at some point, the children will have grown up. So what will happen then to schools and kindergartens, etc.? So in that sense, social infrastructure needs to be flexible, that it can be used otherwise. And I mean, it can already be used in the afternoon for other purposes. So that's what I mean. Then I guess really our conclusion is that growth areas need an integrated approach, a strategic plan, and better sequencing. So the sequencing would actually really help a lot. There is a need for improved coordination between different government levels, which you probably are aware of. And then the really important point is actually that public transport and town centers are also essential infrastructure for achieving more healthy and equitable transport patterns, while at the moment they're actually not treated as essential infrastructure. And to achieve that, we will need political will, strategic planning, and also an evaluation of implementation and more support of implementation. So as I said before, it's more an implementation issue at the moment than a planning issue. And that was it. Thank you.
Thanks very much, Annette. Impeccably timed as usual. We've had a couple of comments. Richard put in an early comment almost preempting your findings that the problem with paths and trails is if they don't necessarily go anywhere, they go in before the other things are delivered, and that's certainly what you've been talking about. James Simple's also sharing some experience from New South Wales, and if James would like to speak to that, because it sounds quite interesting. James, would you like to?
Sure, that's fine. So what I'll start with is that New South Wales has 2 very special programs that haven't been replicated across Australia. The first one is what they call the Growth Buses program, and what this is that the government provides X number of kilometres and X number of buses per year to Transport for New South Wales, and it is then up to Transport for New South Wales to allocate those new services and those new route kilometres to new services, existing services, and to bump up services where required. At the end of that financial year, all that actually gets rolled back into the OPEX budget, and then they get a brand new allocation of funding to actually be able to do this continuous improvement. That was brought in 1992, if I remember correctly, when the Sydney Harbour Bridge got its first bus lane. And that is one of the reasons why Sydney has had such success, relatively speaking, in growing and actually getting some relatively significant bus patronage across the network. The second program I was talking about was called the Bus Head Start program, which was a very specific program that I actually started working on in 2012, which was about accelerating which was about accelerating bus priority infrastructure in new land release areas well ahead of its actual need. So, for example, I'm trying to think of something more Melbourne-like that I can say. Let's just say the Melton Highway to the west of Water Gardens, let's just say it's a 2-lane undivided road and it's got large amount of subdivision going to occur around it. When Vic Roads, the equivalent, will come through to upgrade that road, they will actually put in the bus infrastructure requirements. So like the bus stop bays, queue jumps at traffic lights, bus lanes, the equivalent, at the time they actually upgrade the road, even if there isn't a bus service using it. One of the best examples that I have for this was in Sydney. They upgraded Schofield's Road from a 2-lane rural carriageway to a 4-lane divided road for cars and 2 bus lanes, even though it took 9 months to get a bus to actually run down that road. So, and the other part of that was the government, with the growth buses, actually forced them to have a percentage of the additional buses and kilometres provided to actually go specifically into growth regions for that area. The second part of my comment, I was just frantically trying to find an example, which I'll bring up in a couple of minutes, was in another council area that I used to work with. They had a particular bus that did this really weird zigzagging annoying thing, but it was shown as the solid line, but then near it on what was going to become the main road, they had it shown as a solid line saying bus route on date, and the old route would go. And that's how New South Wales got around route options. They said, we're putting it in right now because this is the only place that you can actually build it or run it, but this is where we ultimately want it to be.
Mm. Thank you. That's very interesting. I think it's some, yeah, I think Richard just put something similar, what I want to say. So it's in a way, here it's the, as I said, that's not the reluctance to publicly plan. So it's really this avoidance. I mean, in a way, there is similar to Sydney. So you have the bus route in the precinct structure plan, which says there will be a bus route, but there is no date to it. So in that sense, that's the reluctance here. And that's where people say they don't really want to put it in. Yeah.
And the other thing I can say is that the developers themselves in certain precincts, if I'll rattle the precincts, but you probably won't know anything about them, is that for East Leppington and a couple of the other ones around there, the private developer actually paid not state transit, but the state government to actually run a bus service ahead of their own schedule to actually try and make it a bit greener and stop the inevitable 3, 4, 5 cars that, you know, these 4-bedroom houses were going to get.
Mm-hmm. Yeah. And that has happened to some extent here as well.
Yeah.
Obviously, it depends on the developer, but some developers have put it in also as an obvious advocacy thing. So I've talked to one developer who was saying, well, we've put it in, we'll put it away at some point, and we assume there'll be a huge outcry, and then Department of Transport has to step in. Yeah. So.
And just the one last thing I'd just like to say about buses, sorry, you can probably tell I've worked in this a lot, is that New South Wales has been doing some really innovative trials with on-demand services, and they've actually gotten some really quite impressive results. So the 3 I'll just really quickly bring up. One was a rural council in the town of Moree. It's about 10,000 people. It used to have 4 bus services a day and got an average of 8 people a day using it. And they moved it to a quite restrictive on-demand service. And within a month, including higher fares, they got 250 passengers a day. The second one I will give is the northern beaches part of Sydney, which is north of Mona Vale. And those buses have increased the frequency in that area from about once every 2 hours off the trunk route to an average wait time of about 17 minutes. And it's an instantaneous on-demand service. And then the third one is a subdivision, a brand new subdivision like what we're talking, which is also reasonably established. and has those narrow streets, which is such a problem, called the Ponds. They brought in an on-demand service here, and from memory, 2/3 to 3/4 of the entire suburb covered by the on-demand has actually signed up for it. So it's that sort of alternative thinking that also needs to be looked at as part of bus planning these days, because the long haul, strict route design is definitely not going anywhere, and it's definitely needed. But there are other places, especially newer subdivisions, where an on-demand service is probably going to be much more superior.
Thanks very much, James, for all of that input. We might follow up with you later if we want to get more details of some of those examples that sound highly relevant. Richard's put in a comment there about Vancouver too, which Annette, you have some experience of a long time ago.
Yeah, but also, again, I can make some advertising for briefing papers.
Yeah.
So we've actually also looked at, so we've done a little working paper on international examples, and actually mentioned exactly this with Vancouver, that there are some, so future bus routes along future train routes, so that actually people already get used to using public transport, and once the capacity is there and the demand is there to actually, in that sense, warrant for other uses like rail, light rail, or they have SkyRail in Vancouver, then it will actually, that business case will be put in. So that's definitely a good example. And again, if anyone's interested in the working paper, I'm happy to send it.
Yes, if anybody wants any of our papers, you can contact us directly or put your details in the chat, just your name, we can follow up with you. Are there any more questions or comments for Annette before we move on to the next presentation? Good bit of chat there. Right. Okay, well, look, thanks very much, Annette. That was great and generated a bit of discussion there. So we'll move on now to Lucy, who's just turned on her camera, who's going to talk about the health impact assessments.
Yep, and I'll just share my slides and okay, I think that looks to be showing. All right, thank you very much for the introduction, Robin. And I'm presenting on the health impact assessment of transport initiatives. And I'd also like to acknowledge my colleagues, Dr. Belen Zapata-Diomede and also Dr. Alan Both, because they've done tremendous work on this project, and I would be remiss in not acknowledging that. And they're not here today, and I'm presenting on their behalf as well as part of this project. Just to give you a very quick overview, I'd like to welcome you all and also to acknowledge the traditional owners of the lands on which we meet. And I'd like to acknowledge their elders past, present and emerging. So welcome everyone to this presentation today. What I'm going to cover is a little bit about health impact assessments. I'm going to go through this work that we've been doing. Then I'm going to go through a couple of examples, looking firstly at the built environment, and then secondly at transport, and also looking at a health impact assessment tool, which we're going to be putting into the Australian Urban Observatory. So what I'd like to go through very quickly is just a bit of an overview about this project, and I'd like to start by acknowledging our funders, which is the RMIT Enabling Capability Platform Opportunity Fund, and especially our partners on this project, which is the Victorian Department of Transport. And you can see that the whole team there, and I'd like to acknowledge all of their contribution collectively. We certainly can't do this project without them, and it's been a really great project to be working on. So what we're looking at in this project is measuring health impacts of active transport. And as academics, we tend to focus on walking and cycling, and you can see a couple of small icons there. And it's quite obvious and perhaps readily understood that there's a physical activity component that comes with walking and cycling. But in this particular project, we're also acknowledging the physical activity component that comes from accessing a bus, tram or train stop. So many people access public transport by walking to the stop. And so So with this project, we can measure that quantity of physical activity. The reason we're focusing on physical activity is that it is a modifiable form of activity. It's something that we can always afford to do more of. It's acknowledged that it has health benefits, and it's something that we can tangibly measure through the minutes that we spend doing that walking. When we do that, in calculating measures, the minutes spent walking, we can compose a measure of health from that, and that measure of health can be included in economic appraisal. So with a lot of economic appraisals, the cost component is relatively easy to calculate. There are established methods for doing that. But when it comes to the benefits, that's a much harder quantity to calculate. And health is one of those quantities that can be calculated, but it's actually still quite complicated to calculate. So in calculating health and to some extent other intangibles, which we're also working on, we're hoping to redress the balance in this equation that sits between costs and benefits. The reason we're doing this is to really help provide evidence for making decisions in terms of, well, hopefully in favour of supporting active forms of transport in particular, so supporting infrastructure. But in doing that, we're hoping to really influence the way that we plan and build sustainable cities, so moving away from the car where possible, but also in doing so, influencing the health and wellbeing of residents. So in terms of what a health impact assessment is defined by the World Health Organization as a means of assessing the health impacts of policies, plans and projects in diverse economic sectors using quantitative, qualitative and participatory techniques. I've underlined a couple of words there because I think they're particularly important. The first of those is health impacts, and health in this framework is defined quite loosely and broadly as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So when we're assessing the different kinds of policies, plans and projects, taking a very broad view of health allows for a lot more flexibility, because you can imagine that policies, plans and projects come in all different shapes and sizes, and it's very important that people who are in charge of the health impact assessment have flexibility to pick the right kinds of health to measure. So in our particular project, just coming back to this idea of how we measure health impacts, in doing quantitative, qualitative or participatory techniques, the work that we're doing in this project is looking at a quantitative technique. So the key aims of a health impact assessment are really to enhance policy development, and the idea is that this is done based on evidence. So in our case, it's quantitative evidence and also academic evidence that we produce as researchers, but also that it's focused on the outcomes. So it's about understanding what kind of health impacts there are that come from having a policy or some kind of infrastructure plan. In some cases, those outcomes might be negative. In some cases, they might be positive. So the idea is that in doing a health impact assessment, you're trying to improve those positive health impacts, but also mitigate the negative ones if necessary by adjusting the policy or adjusting the plan. So in order to do that, it involves partnership between the different sectors. And the reason for that is that the health sector is not known for helping itself necessarily. It's quite hard to do, and it's actually other sectors such as transport and infrastructure and the utility sectors. Those sectors actually have a huge influence on health as well. The health impact assessment has a number of different steps, and I won't go through these, but it's just to really acknowledge that it is a formal process, and that formal process has a number of steps, and it's been applied globally. So there's lots of good resources out there. And for those of you who are more interested in learning about health impact assessments, I can point you in the right direction if you're interested. So moving on to a framework that helps to motivate this work, our work sits very firmly in terms of the built environment. So as planners and also people who measure the impact of the environment on health behaviours, the built environment can be composed into a number of different factors, including density, land use diversity or land use mixes, distance to transit, design. So this would include things like street connectivity and the way we construct the blocks, destination accessibility, and also distribution to employment. So these factors we refer to as the built environment. That has a huge influence in what we do, which is in terms of behaviour, so walking, cycling, car use or public transport use. And that in turn exposes us to a number of risks, and that it can include physical activity, but also the air we breathe, noise pollution, also road injuries. that has an influence on our state of health. And when I talk about health, morbidity is a state of sickness, and that relates to non-communicable diseases and also acute diseases and also road trauma. But some of that can lead to death, which is mortality. So morbidity is just the rates of sickness, mortality is the rates of death, so premature death. This work, particularly the built environment work, follows from the publications that are listed there at the bottom of the slide. So I'm just going to focus on the built environment initially. And I have some statistics here, and these statistics came from the Creating Livable Cities in Australia report, and they've also been packaged up into an academic publication, which again is listed at the bottom of the slide. But these, what that report essentially did was look at a number of different policy targets, particularly the ones here in Melbourne, and you can see at the top there that one of these comes from the Precinct Structure Plan guidelines, and it's destination, it relates to destination accessibility. So the idea that 80 to 90% of residences or residential lots sit within 1 kilometre of an activity centre that's large enough to support a supermarket. So in Melbourne, only 11% of suburbs have such accessibility. In terms of dwelling density, policy targets suggest 15 dwellings per hectare, and that was previously, I believe, in Plan Melbourne, but also the Precinct Structure Plan. Both of those have now been updated or are undergoing a review process. But at the time of this report, only 23% of suburbs had met that target. In terms of distance to transit, 95% of residential lots within 400 metres of a bus stop, 600 metres of a tram stop, or 800 metres of a train station, only 14.1% had access at that level. And as you can see, and I won't go through the other two because I think you can perhaps read it quite quickly for yourself, these rates here, these percentages in the right-hand column are not really meeting these high targets of 95% or above 80% in the case of the first one. So Melbourne's not necessarily implementing what is being said according to the policies, but this is also acknowledging that there's room to improve. So we'll move on. Now that what's in our built environment can influence, of course, our behaviour. So we'll just focus on a few stats behind that. What we know, and this data comes from the Victorian Integrated Survey of Travel and Activity, you can see here quite starkly that car is king. So 63% of the trips that were made by car as the main mode of transport. Going up the graph, so walking is the next one at 26.7%, and then public transport at 8.4%, and 1.3% for cycling, and then 0.7% for other. So this sort of suggests that there's an opportunity to do some shifts, but the next slide perhaps spells it out a bit more clearly. When you break that usage of transport mode by distance, I'm just going to ask you to have a look at these red columns. So red is for the cars. Now, in the case of distances less than 1 kilometre, only 15% of trips are done by car. But when you look at 1 to 2 kilometres, 52% of trips are done by car. And then as the distance gets further and further, you get more and more trips done by car, which perhaps is arguably fairly reasonable. But this represents, particularly in the case of 1 to 2 kilometres, this 52% just on that second graph really represents an opportunity for us to swap those car trips into these more active forms and to try and recognise some of the health benefits that come from that. So in terms of the risk exposures, I mentioned previously that physical activity is something that is modifiable. And just to give you a sense of what the physical activity rates are in Victoria from 2016, so this is from where did this come from? Department of Health and Human Services. So we had around 50% of people meeting the physical activity guidelines. So the physical activity guidelines themselves are that we do half an hour of exercise on at least 5 or more sessions per week. So ideally hitting around 150 minutes worth of physical activity. What these statistics say is that only 50% of people are doing that, and it's relatively evenly split between males and females at 50% and 49.2%. So again, there's an opportunity to really do more in terms of physical activity. So how this affects morbidity and mortality, that's our next thing to look at. So here we have what's called a disability adjusted life year. So that's what DALYs stands for. And it's really a holistic measure of health that morbidity and mortality. So just as a reminder, morbidity is these rates of sickness and mortality are the rates of death. So what we have here, and perhaps it's quite clear that this is in terms of what these statistics are telling you, so type 2 diabetes at 19%, it's really the contribution to type 2 diabetes that comes from being physically inactive. So if you are more active, this percentage would go down in terms of its contribution to type 2 diabetes as a disease. So you can see from all of these diseases, so if you just drop your eyes to stroke, which is the last one at the bottom, around 10% of the disability adjusted life years for stroke is attributable to physical inactivity. So these rates here can be adjusted if we were to do more physical activity. So what we have in terms of the methods for the modelling work that we've done is that we have a model where you can put an input in. So if you just look at these yellow bits, the idea is that we take people out of their cars and we get them doing more walking and more cycling. And if we do that, they're doing more physical activity. And if you do more physical activity, that improves the rates of both morbidity and mortality, so sickness and death, that are associated with cardiovascular diseases and cancers and type 2 diabetes, which relate back to a lack of physical activity. So when we do that, we can recompose this using what's called a proportional multi-state life table. So what this does is take our group of people, so we have, you could call them our guinea pigs, but it's our population of people. We can apply those rates of morbidity and mortality, so the proportion of people who are sick and who may die. Every year, a certain proportion of them become sick and some of them die. And those who remain move to the next year of the simulation. And again, a certain proportion become sick and also die. And those who remain move through to the next round of simulation. So this proportional multi-state life table goes year by year according to and applies those rates of sickness across a lifetime, essentially. And we simulate this for 100 years. And when they get to 100, we kill off the whole sample. So this is just to stop the simulation going perpetually. So that's the framework for our model. But when you do that, it allows you to understand what happens between a business as usual scenario and also an intervention scenario, or a scenario where you're swapping people from using their cars to being more physically active. That allows us to adjust these quantities that are in the orange box at the bottom. So the life years, the health adjusted life years, and health adjusted life years are a similar kind of thing to a disability adjusted life year. It's looking at a holistic measure of health that factors in quality of life. Again, there's life expectancy, health adjusted life expectancy, deaths and incident cases. So that's the framework for this modelling process. And we essentially have some code that crunches through that for us, and that spits out some numbers which I'm going to present to you very briefly today. As one example, we looked at the physical activity related health and economic benefits of building walkable neighbourhoods, a modelled comparison between brownfield and greenfield developments. And in this particular body of work, what we did was look at Altona North and Truganina South. We used the built environment measures of each of those case studies to really explore the probability of transport walking, so the likelihood of people doing some form of walking. And from that, we also calculated the health adjusted life years and a version of economic value. And we did that using a planning support system and the model that I just explained to you schematically previously. So this is the sites that we have, and in Altona North, it's up the top. I'd just like to draw your attention to the surrounding area with these pink dots. These pink dots up the top are really showing the different types of destinations. Well, not the different types of destinations, but the location of the destinations. You can see just from eyeballing, there's a lot more of them in comparison to Truganina in the south, the picture in the bottom here. So the idea here is really that the environment in Truganina is quite different to the one that's in Altona North, and we were essentially able to measure that. And in measuring it, we're able to look at the likelihood of walking. So just in the interest of time, I won't go through all of the different variables. You can see them on the left-hand side here. But the key thing to be looking at is the very bottom line. So in the bottom right-hand corner, if you lived in Truganina, according to the built environment that we measured and our logistic regression equation, which is just an equation that helps us predict the likelihood of walking, only 26% of people in Truganina were likely to walk given their environment. But looking at Altona North, which has a slightly, we would say, an amenity-rich area. So in comparison to Truganina, it has more amenity, more destinations, more public transport, greater street connectivity. It's essentially more established, but that translates into a higher likelihood of walking, so higher probability of walking. So when you do that, using our quantitative health impact assessment model, it essentially results in 1 month lived with full quality of life. So if you live in Altona North relative to Truganina, you could live for longer without sickness, without premature death. And that translates into a value of $4,500 per person for the population that we looked at, which was roughly 21,000 people. I know this doesn't sound like a riveting amount of money, but if you apply, or you were to apply this across a full population, that value really translates into millions of dollars. What we're doing next with this tool is building it into the Australian Urban Observatory. So we're going to allow, there'll be an extra menu option at the top of our website, and that will help guide you towards the health impact assessment tool. It will follow similar tools where you can have different input fields, and from there you can calculate your own health impact assessment model based on your own inputs. Those inputs are listed in this table. So the idea is that you can look at different people, so female or male or the entire population. You can look at it by age. You can look at the distances if you want to replace with walking, and also distances if you want to replace with cycling, and some kind of filtering down to the trip purpose itself. We have got a very short example of that, and I'll very quickly take you through this. The idea here is, and as you saw previously, we could replace car trips with walking and cycling, and we can also replace those slightly longer car trips with cycling. So in essence, if I just draw your attention to this red spike, if you were to redistribute these people driving into walking and cycling, we're increasing the walking, which is this sort of aqua coloured spike here in the histogram, and then also increasing cycling. So it's a huge jump in cycling. If you are to do that, we can actually simulate the health impacts of doing that, and this is what it looks like. So this is just some preliminary results, and I'm just going to, I've put a circle, not a circle, I've put a box around this one here, and it's looking at stroke. So this is mortality, so this is people dying from stroke. And at simulation year 60, so this is where we've gone through that proportional life table 60 times, what it's telling us is that at that exact point, 200 people didn't die. So we've reduced the incidences, so 200 people are not dying because we've got them to be more physically active and they're not dying from stroke. So this is what this graph here is telling us. Essentially at each point, there's a certain number of people who are not dying. So if we're looking at a simulation year of year 20, it's around 100 people. So we saved the life of 100 people at that point simply because we've got them being more physically active through the scenario that we've implemented as a hypothetical in this case. So the key points to make about some of this modelling is that health is important to measure. We're aiming, with this model in particular, we're aiming to provide some research evidence that helps support decision making and improvements to policies. We're helping to redress that equation between costs and benefits. The outcome that we're seeking to do with this work is really to have well-planned, sustainable, healthy and functional cities. And I think that's it for me. So thank you very much for listening, and I shall relinquish control. Back to you, Robin.
Thanks a lot, Lucy. There's a lot in that presentation there. We haven't got any questions yet in the chat. Has anybody thought of something what they would like us to see?
Sorry, it's James here.
James, yes.
I might just do a quick one here. Obviously, I'm a very pro public transport and active transport person, and the one thing I'll say is I live in what's considered a very walkable suburb, which is North Melbourne, if you're wondering. But the issue that we have here is, especially with the public transport links and the active transport links, is they all assume that you only want to go to Melbourne, or slightly less that you want to go to Footscray. And the issue with that as a transport planner is that they make up probably 60% of the journey to work trips, but they might make up only 10% of the every other trip. And the journey to work trip, as most of you know, is usually only around 15% of all the trips made on an average weekday. And that in part is what needs to sort of get elaborated on, because what I found in my career is that journey to work is God, and journey to work is God only because it's easily measured. And
that's right.
And I know, sorry, just to butt in, that the City of Melbourne's doing a lot of cycleway, their temporary cycleway pop-ups around my area, and they've completed several of them, but because they've still tried to keep the parking, the cycleways that they've actually put in are still not what I would consider particularly safe. I cycle, but I'm not the frank or fearless or the next level down. I'm probably what the confident but scared, I think, was the level. And that's the other issue with the cycleway infrastructure that is being built, that it's generally being built for the 15% who would cycle anyway, and it's not for the other 70% who may cycle but don't like the infrastructure or the traffic volumes.
Okay, thanks, James. Did you want to comment on that, Lucy, or on the question that Billy's posed?
I'll comment to James first, actually.
Mm-hmm.
Just in working through the modelling that we've done, we acknowledge that it's a relatively conservative set of estimates, reason being that the focus is on what we would call active transportation. But in that particular body of work with Altona North and Sugar Nino, it was looking at transport-related walking. So the concept there is that you're walking for a very specific purpose. I completely agree and acknowledge also that there's recreational purposes that people undertake physical activity for. And this links a little bit to what Annette was saying, that in some of the outer or in the growth areas, there tend to be higher rates of recreational activity. It's not that we can't apply the health impact assessment modelling that we've done to recreational activities. It's just that there tends to be a focus on like purpose-driven trips, simply because
with that,
so I'll just finish what I was about to say. The emphasis on purpose-driven trips is because it's more it's a routine type of behaviour. So people in the past, pre-COVID, were going to work every day, and that's physical activity that is, I'm going to say it's insidious. It's something that we have to do, and because of that, there's long-term sustained health benefits, and that's why we tend to focus on it. So it's not that we're not turning our attention to recreational things, but I think also the point you're making is about the infrastructure not being, I'm going to say, ubiquitous enough, and we agree that we think that's a problem. So
what I was meaning though was that my area is generally well serviced, but people will use the car for trips that they could do easily with walking, like say to go shopping, which is one of the key ones that most people do most today, to do childcare, to go to schools, to those sort of things. They're not necessarily recreation things, but the things that you do every workday that they will do by car. And I'm in one of the most densest ones. What I'm just was trying to say there is that it's something that hasn't been done as well in Victoria, because there's just been that such focus on the journey to work. And that is what everything in the public transport system, whether it's roads, active transport, public transport, has really been focused on.
Okay, thanks for that comment. Certainly, we've been very aware of the issue about town centres and walking for shopping, for example. Lucy, Melanie's put in the chat just a question, I guess, inviting you to make the connection, particularly for local government, you know, how they might be interested in healthy impact assessments, or how it might be helpful for them in their context.
Well, I think in the context of local governments, it's going to assist them, particularly from an advocacy point of view, and feeding into things like the municipal health and wellbeing plans, being able to provide evidence and be able to say what the benefits would likely to be, particularly for infrastructure that is missing. So this hypothetical, if people could travel from A to B in their own suburbs because they had better infrastructure, it's nice to be able to back that up to say that if we had that infrastructure, this is the likely health benefit that we could get according to a health impact assessment tool. So the tool that we're providing is going to help people actually quantify the health benefits that can come from those hypothetical scenarios. But really that's putting, I'm not going to say pressure, but putting evidence in place to advocate for better infrastructure that supports active transport.
Great. And I notice you've replied to Billy's comment. Do you want to just speak about that? Billy was suggesting that the built environment attributes of Altona North are still quite modest compared to the inner city, like the example of North Melbourne that James was bringing up. So have you considered, if the environment was similar to the inner city, what the health results might be?
We have considered it, but it's essentially, in a way, it's a sort of capacity issue as to how we can actually do that, and it's certainly a great idea. But really what it's this idea that if you were to improve the growth areas and give them some of the qualities of the inner city areas, what would that look like in terms of the health impacts? I think it's a really great point, and I think it would be a great thing to do. At the moment, we've got our focus on transport, so that's where we're looking.
Great. Now, Joanna's put in a question about air pollution and walking. Is air pollution also considered when walking and health impacts? Some areas of the Western region have high levels of air pollution, impacting their health and wellbeing and preventing them from leaving their homes. You've got a comment about that?
Yeah, so what I can say is that the health benefits that come from walking and being physically active, so also cycling, research tends to suggest that those the physical activity impacts outweigh the impacts that might come from breathing in poor quality air. And so they do seem to be at odds with one another. But with our health impact assessment work, we are planning on improving it and factoring in air quality and also road injuries. And I'd just like to point out that we were very lucky to get a grant with the UK Research Institute, also funded by the NHMRC, which is the National Health and Medical Research Council. And that work, that particular grant, is specifically looking at building up our capability here in Australia to do health impact assessment models that do have air quality data and also road injury data in addition to physical activity. So yes, we are considering it. We will be looking at that in the future. A great question too. Thank you.
Just to add to that as well, Lucy, sorry, and I think Hobson's Bay is online as well, but Altona North is one where EPA often say stay in your home because it's too the air pollution is too high. So when you're thinking about examples, that one, people are kind of homebound as well.
Yep.
Now, Bright is asking about can the tool be used at a municipal scale as an input, for example, to an integrated transport strategy?
Yes, it could be, but it's not so much I think I have to go back a step. So it's using epidemiological information. So this is your mortality and your I can't say it now, morbidity data. It's using that from Victoria. So it's not so much to do with the municipality scale per se, it is to do with Victorian data that relates to the population of people. But it could be the case that your intervention is targeting a certain number of people. And that's where you're, sorry, if you're looking at a certain number of people, that might be what's related to your municipality. So your population size is really coming in through that particular input. So it's kind of a yes, but it's also with some limitations.
And then a bit of praise from Liam saying, great work, Lucy. I could see setting a desired health target and using your tool to assess applications and providing the results back to the applicants.
Yes, we hope so.
Yeah. That's great. Well, look, thanks very much, Lucy. I think that's the end of the questions and comments at this stage. So we might move on to our third presentation. If Melanie's ready, she's going to talk about the Australian Urban Observatory.
Yes, thank you, Robin. And I'm just going to get a presentation up. If you can bear with me. Okay, so we're good to go. Screen is up. So I'm going to move through today and just provide a presentation on the Australian Urban Observatory. And you've already heard a little bit about it from Lucy and some mentions as we've been going along. So I'm going to take you in a very different direction now and explain what this project is about and why it might be of interest to you. So moving through, to begin with, the Urban Observatory includes a number of livability indicators in it. And really, when it comes to the development and application of indicators, having the connection to theory is essential. And many of you will have heard the term livability being mentioned many, many times. But it's really important at this point that we're able to think about what does it mean and how can we measure it. And that understanding of what does it mean is really important when it comes to understanding why and how you want to measure it. So this goes back to a project with colleagues back to around 2012, 2013, when we came up with this really comprehensive definition of livability. And you can see on screen, it is a safe, socially cohesive and inclusive place. It is environmentally sustainable with affordable and diverse housing linked via public transport, walking and cycling infrastructure, so employment, education, public open space, local shops, health and community services, and leisure and cultural opportunities. So that is a broad definition, but it's also an important definition because, in my opinion, it also makes intuitive sense. It's not just something that we're talking about from a high level academic or theoretical perspective, but it also makes sense, and they're the sorts of things that people look for when they're looking for a place to live. So these are the real essential ingredients that we believe are important to having a livable place. So I want you to keep that in mind as we move through. Now, why is livability important? And this is that connection. And it's not just an ideal where we think they're nice things, but we're really trying to connect the social determinants of health to place and planning. You can see the screen on side, on the diagram to the side here from Barton and Grant, which is that map of the social determinants of health. Now, this is not just jargon, but really describes that where you're born, your postcode is important. Where you're born, where you live, where you work, where you play, where you learn, where you age. These factors about that local environment are really essential to your long-term health outcomes. So it's not just individual factors, but these natural and built environment as well as social environment factors that are around you. So for us, that understanding of livability really enables people to think about the role of people and place. Livability indicators really take that research evidence and make these connections. But importantly, they also have been developed with the understanding about having a policy lever connected to each of those livability indicators that we create. So it's taking research knowledge and connecting it up across these different areas. In terms of indicators, this is a term that gets used as well, and I think it's really important to be clear. So an indicator really does refer to an aggregated result based on complex data. They are very important because it's not just the measurement itself, but they have been developed. And I guess this work really came from social indicators and then moved up into economic indicators such as the GDP, but then into environmental indicators. And the way that we would think about the use of indicators, it's really to support participatory and deliberate democracy. So they're not unbiased because really in terms of what we're developing within the Urban Observatory, it is built on that understanding of livability, but also connecting these ideas of where you live and the connection to health and connecting those with city design all together. In terms of those perspectives, we really want to include a range of different perspectives in the development, application and dissemination. So it's not really going to be as useful if we're not working in partnership with people. And so for the development and the application of indicators, we're really seeking to develop them, to work with partners to understand how they're useful, what is maybe missing in terms of those key issues that are working, or the hot issues as I would describe them for practitioners on the ground, and also ensuring that we're developing new indicators over time that address those issues. So it needs to be that feedback loop between both ourselves working in the research area to translate research knowledge, but also to work with the partners outside. And so that application partnership side of indicators is essential. Otherwise, they just become another portion of data out there in that world where there's a lot of data out there and it's hard to know what is the best piece to use. In terms of indicators themselves, I would describe them, as this diagram shows you, as the tip of the iceberg. So an indicator is that aggregated data across social, economic, environmental issues applied at a geographic level, such as a neighbourhood or a suburb or a municipality. In terms of the tip of the iceberg idea, this is saying that indicators do not say everything, but they definitely direct attention to issues that need addressing. So it may be that that issue or particular social, economic, environmental issue, it may be a good result, but having a bad result is also not something to be concerned of, because what we want to do is really try and understand why that's occurring and how it can be addressed. So it really is part of that cycle of identifying where are we doing well, where are we not doing so well, and how do we make a difference to improve that over time. In terms of research and the connection to policy, that they are tools for policy, monitoring and reporting while supporting democracy. So in terms of policy, all indicators when they're being developed need to be able to take together both the research knowledge, the needs of the practitioner, the needs of reporting, but also supporting democracy and having that policy connection. If there's no policy lever in there, then that indicator is not going to be useful. So these are the sorts of things that go into the thinking behind the development of those indicators. In terms of the observatory, what is this thing we keep talking about? It's a digital planning platform, really in terms of transforming complex urban data into livability indicators for 21 cities. And they are the largest 21 cities across Australia. In terms of Victoria, we include both all of the municipalities across Melbourne, and then also the largest regional cities, which include Geelong, Ballarat, Bendigo and Albury-Wodonga across Victoria. So it's the 13 largest regional cities of Australia and the 8 capital cities. What we're trying to do with the observatory and why that name exactly comes in here, it is really to try and encourage observation and understanding about the important social, economic and environmental issues of the day. So really it's taking people out and providing an opportunity to look and think about where we're doing well, where we're not doing well, where do we need that intervention. We're trying to make this concept of livability easier to understand, but also measurable, so that you can look at what's going well and what's not. And the real key here is trying to translate research knowledge into something that's useful for practice and to create impact. So we all want to see better places, we want to see healthier people, we want to build better communities, healthier communities, more livable places. But without this knowledge, it makes it harder to do that. So the whole team coming together in the production of the observatory is really to make that research knowledge useful. Very easy for us as academics to write papers. Well, perhaps it would be nice if it was easier to have time to do that. But what we're really trying to do is to make the world a better place. And this is the opportunity of taking that research knowledge and getting it out there and useful. And you can hear in this conversation also that it's also underpins that real importance of partnerships with people using the information to create that continual cycle of improvement too. In terms of the value of the observatory, these are livability indicators designed to inform policy planning and practice. So it's not just for one purpose, but it's to combine all of those things together. What we want to see is really evaluation in terms of policy outcomes and policy aims and objectives. So it's very easy to design and come up with a policy, and it takes a lot of time to get that out there and for people to be practicing it. But it's also very difficult in practice to be able to go back and evaluate, well, how did that policy go? Did this actually make the change that we were seeking to when we developed it to start with? So to try and encourage that evaluation in an easy manner. So we want to evaluate and monitor policy outcomes over time. The other thing is we also, in the observatory, will be creating the indicators and updating them so that you have time series data and people can go back and look at those changes over time. We've only launched this year and we'll be continuing to create both updated indicators and new indicators over time. Really, this is the key thing. Save money, time and people resources. We don't want to see everybody recreating the wheel and getting people together and employing a whole heap of data analysts when somebody else can do it for you. So it's trying to take that burden away and to make it easier to use research knowledge and use evidence in planning, but make it so it's an easy task rather than a complex one. And really importantly, in the use of indicators, it is to be used as a tool for engagement with the community. So these results have been, the visualisation of the livability indicators, I should say, are really designed to make it easy to have conversations with people. You don't need to be a data analyst, you don't need to be a statistician, you don't need to have a high degree of computer science, but it's really results that are out there, easy to talk to for anyone in the community. In terms of the team and who's produced the indicators included in the Australian Urban Observatory, you can see a whole range of different faces on your screen in front of you, and all of these people have been pivotal in the development of those indicators. I'm now going to overload that and see another row of people in the middle here, and they have been really pivotal in the development of the platform itself. So we've got two issues in terms of bringing the Australian Urban Observatory together. One is the development of the indicators, which has taken over 8 years to produce all of that information and the technology used to produce them. And then the other part is the development of the web portal itself. So this is not something that we can buy off the shelf. It's been developed along that program across that time to really make something useful for the purpose that we want to use it for. What's in the observatory? We have a liveability index, a walkability index, a social infrastructure index, transport, food, alcohol, public open space, employment, and housing. So these are really the key domains that are included in the Australian Urban Observatory, and we have a number of measures for some of these domains included in the observatory, so that you can look at individual measures as well as overall measures. So the Livability Index and the Social Infrastructure Index are both available free to the public right down to the neighbourhood level. So I'd encourage you to get onto the website at some point, register with the AUO, our website, I'll show you in a moment, and then you can go through and have a look at the results. And where does everyone go? The first thing everyone does is look at their local area. So here is our pretty front page. And as Lucy mentioned earlier, we will have on this homepage, we'll actually be creating a new section for the health impact assessment modelling that will be available in early 2021, and people will be able to come in there and use that model themselves. So this is the home page, and if you come into this page, if you register, then you can go through and it will take you through to that map portal, and I'm going to show you some demonstrations of what that will look like. There's also other resources on the page, and there's information about what we measure, which people might be interested in, and also scorecards for the 21 largest cities. So this was developed earlier in the year, and you might be interested to look at scorecard results for the whole city level. So those whole city level scorecards have been created for all 21 cities. And those 21 cities also match the National Cities Performance Framework, which is developed by the federal government to look at changes in livability across cities over time. So that's why those 21 cities have been included. You go to the About section, you'll also see we have an FAQ section so that people can go through that and have a look at some of the questions you may have afterwards. So now I'm just going to take you in. So this is once you've registered and you've come into the portal. What we have available here, a livability index, is the result that we've got up here, but the indicators are available at the LGA or municipal level, as well as suburb and SA1. And the reason we really developed them down to this neighbourhood level is that we knew that people were looking for it. Back working with Community Indicators Victoria, I would get questions all the time about, haven't we got further data? Haven't you got lower level data? And in the past, LGA data actually was as good as we can get. But when we use a map to spatial level, we know that we can get down much lower. So we can get down to suburb, or we can get down to the detailed neighbourhood level. So that detailed neighbourhood level we refer to as SA1, or Statistical Area Level 1, consistent with ABS and the Australian Geography Standard. So I'll just give you an example now. So this is the livability index up on your screen, and you can see in the top right that we have this result up for the local government area level, and we can see a pattern. Perhaps across the middle, down to the southeast of Melbourne, you've got better livability. Green is good, red is bad. Moving down now, I've got the same result, but at the suburb level. So I'm just going to flash back up. We can see, okay, one pattern, we go back down, we can start to see a bit more variation. We can see some green areas, so some good areas of livability popping up around different areas down to the very south of Melbourne, but also out to the west. And so this is really important because when we're looking at LGA level data, you get that really aggregated effect and you miss out on those pockets that are doing well. So we're not so much interested within the Australian Urban Observatory at comparing Sydney to Melbourne, but what we are interested in is looking at where well at that detailed level so it can really direct intervention. We want to increase livability across the city, and the easiest way is to look at, well, if I'm creating an intervention, where's that key area that I should be putting it in? It's very difficult within local government because it's managing a lot of different interests, but if we've got evidence to support action, it makes it much easier to have those conversations. So this is the example at suburb level. Now I'm going to move down one more time. And this is actually at the neighbourhood level. So neighbourhood or statistical area level 1. And you can see up here, I've still got the livability index up, but I've highlighted the suburb that I've picked. This one just happens to be Vermont out in Whitehorse. And we've got a scorecard to the side that talks about, well, what is the result? What is the area selected? What is the suburb it's in? And then you can see there's a whole range of results down on the livability scorecard on the side as well. So you can go through and look at the information and understand, well, if my livability score for this area, this happens to be 97.9, that's great knowing that 100 is average. But we know that if, like IQ, we think about the livability score so that anything above 100 is very good, anything below 100 is not as good. And we can see for this particular area that we've got a score of 97.9, and there may be factors influencing what is creating that lower score. You can see down here that one of the key factors on that scorecard is local employment. And that decreased level of local employment could be contributing to that decreased livability index score as well. Now, moving on further, I'm going to give you some more examples. So here I'm taking an example out and I've actually picked up Truganina. And you can see, I'm not sure if you can see the little areas highlighted where I've clicked on the SA1 in Truganina out to the left. And that area there, for this particular indicator, I've asked to look at average distance to closest activity centre. So for this particular neighbourhood I've picked up, you can see it's an SA1 with its particular code or ID within the suburb of Truganina, and the average distance to closest activity here is over 4 kilometres. Now, obviously, this is going to contribute to livability, and there's a whole range of factors in there. But also it's got that real impact on health. And I'm going to look at some more transport related indicators in the following section. So as I move through here, I'm going to move into another example. This is average distance to closest public transport stop. And I've moved out a little on this picture, but you can see again, I've picked Tarnate out at Wyndham. And I've just picked one particular area, and you can see in terms of the distance to closest public transport stop here, we've got a distance of 347 metres. So that, in terms of the range, you can see underneath, and the interquartile range produced for that area, but also can connect it into the livability score and all of those individual domains underneath. You can also see, yes?
Sorry, just really quickly, with your average distance to public transport stops, is it line of sight or actually following the road?
It's following the road network.
Thank you.
No problem. Well, I haven't got many more, so I'll just get through these and I'll hand over to Robin and then she can take those questions. Won't be long. So then we've got average distance to closest public transport stop here. And in this example, I've moved across to the other side of town and I've actually highlighted an SA1 in the suburb of Berwick. And we've got Casey. And this one is looking at the average distance to a closest public transport stop. And we can see that the distance here is only 172 metres. So slightly different, but also when you get down to this SA1 level, you can see that we have this patchwork of green and red. So it's not to say that all areas are doing bad or all areas are doing good, but what we really want to understand are those neighbourhood level results. And so that's why I've highlighted them. Now, in terms of one of the final ones I've got here, % of dwellings within 400 metres of public transport with regular 30-minute weekday service between 7 a.m. and 7 p.m. And we get a very different picture happening. So I'll just go back up once. If we go back up, this is average distance to a public transport stop. And this one here is % of dwellings within 400 metres with frequent public transport. So it's okay to have a stop up there, but how often that is serviced is one of the critical factors as well. So you can see I've just given you an oversight of what's available in the Australian Urban Observatory with these pictures. And what I would encourage you to do is to go in and register yourself and have a look at some of these results across your area. One of the key things in there with the Australian Urban Observatory is that we have the Liveability Index and the Social Infrastructure Index, all available right down to the SA1 or neighbourhood level for all 21 cities of Australia. In terms of the other indicators, we make all LGA data available free, but we do ask for a partnership if somebody was wanting to access all of the indicators down to that suburb or neighbourhood level. So I encourage you to go and have a look. And if you have any further questions or anything like that, please don't hesitate to contact me. So we've got the web address up there. It's auo.org.au. And I am finished. Thanks very much.
Thanks a lot, Melanie. Oh,
sorry, I myself for you, Robin.
So, have we got any questions for Melanie or comments? Again, there's a lot of information there. Hopefully you're seeing some of the ways in which the Urban Observatory might be useful to you in your local government role. Joanna's got a question. How often is the data updated?
Yes, we want to try and make sure that we're updating that. Well, some of the demographic data, I didn't actually mention, you will have seen down in the bottom right side of that page, that the demographic data will be going in with the census. So next year, we will hope to have an update of some of the demographic data, and we would only do that according to the census time periods. But in terms of the indicators, they really need to be updated on an annual basis. For them to be updated annually, it means that people can really do that check across time. And that's going to be particularly important as suburbs or growth areas, and suburbs grow and develop and change with time.
Now, there's another question from Fuong asking, will there be benchmarks of desired target website other than comparing to an average?
No, because that depends on where somebody is operating and what those particular targets are. So rather than us telling you what targets we think they should have, you're able to set your own targets and then measure and look at those change across time.
Okay, nothing more in the chat. Perhaps you could outline how, what levels of engagement local governments could have with the Urban Observatory.
Yeah, sure. So I guess it depends on where local governments are at, but one of the things what we're finding is that we have a few existing partnerships, and with those partnerships, it's really interesting to spend time to understand what are some particular needs or how that might be. They might have particular issues. So we have all of these indicators available in there, but there's much other work that we would do in terms of customising and developing new indicators. Working across regional areas is a really good example of that. And for the last few years, we've been doing that and working with local governments and government departments across regional areas of Australia too. So there's that other side of it. And a new product that we're just about to release, we'll do early next year, is a local government area scorecard. So as I mentioned in the presentation, we have a city scorecard, and that's across the whole city as a whole, whereas now what we're trying to do is create a new focus on terms of local government area to produce the actual data in terms of results for suburbs, so that local governments can look at where are the areas that are working well and where are those areas that are not working well to really inform some of that work. So that might be another way of engaging if they weren't interested in being using that portal.
Terrific, thanks. Now, any more questions or clarifications?
And if not, Robin, I've got some questions for them.
That's right, I know. We're gonna make the audience work a little bit in a second. I'll just wait and see if anybody's got any more comments. Doesn't look like it, so perhaps I'll hand back to you, Melanie, for that.
Yes, I have some questions now. I would like to get up now. Of course, in between, I have lost them. They've gone. Unusual. I'll try one more time. Give me a moment, Robin. Something is not behaving.
Okay, not to worry. This was an exercise that Melanie did in a forum last week of putting up some questions, and then we can all answer them and see the results as we collectively respond, which is, you know, I think really, really engaging. But sometimes the technology doesn't always quite work.
You know what happened to me? A computer died in between us starting this presentation.
No good. And just work on it for a second, and it's got a comment.
Yeah, I thought I'll go in while Melanie's trying to get up the questions. And I thought I'll just already ask one of the questions that we want to ask you anyway, and that's really what disseminations channels are you interested in or do you find useful? And the reason behind that question is really, so we, as I said before, for example, we have some briefing papers, working papers, etc. But we've also written some little articles in Planning News. But the question is really, what would you be interested in? So what other channels could we use to actually bring our results out there? And that's, well, for all of the work. So really, well, I think Melanie wanted to ask that question in the Slido presentation, but maybe if you could type it in the chat for now so we could just talk a little bit about it, or maybe if you have any other comments on dissemination, just let us know.
I think that's a very good point, Annette. I mean, as hopefully everybody on this call can see, we generate a lot of research, and as I think Melanie said very clearly, the whole purpose of our research is to have an impact and to try and help people working in local government and in fact anywhere to improve the built environment for obvious reasons. So if there's a way that we can make our information more useful to you, that's certainly what we're always keen to hear. Melanie, I don't know how you're going, but Joanna had a question about saying that local governments are starting to do mapping around the 20-minute neighbourhoods. And do you think the Australian Urban Observatory could help with that? So perhaps looks like you're getting the presentation going, but maybe yes, you can also respond to that question.
Did you see that? Did that come up?
We did, yes. It's gone
okay.
Again. But
all right, I'll try one more time. I don't know why this computer is not behaving, but you can't see now, right?
Right.
Let's try it one last time.
Did come on for a sec.
Okay. Window, desktop, try this one. Does that work?
Yes.
Oh, thank goodness. Okay, so sorry about that technical issue. I'm now going to ask you if you could all please grab your phones. I'll just turn my camera off for a moment. If I can you can grab your phones. If you actually put your camera, just open up your phone. You don't need a QR code scanner or anything like that. Just put up your phone across that QR code and it will take you directly to a website, and you should see this question in front of you and you can vote on your phone. If you prefer not, you can just go to slido.com and use the code hashtag X371 and you should also come up with this question. Now, there we go. We've even got results up. Fantastic. We've got 14 people, 15 people have participated. So the first question here is, are you interested in using a tool to quantify health impacts of transport in your practice? Wow, this is an overwhelming result. 79%, 75% saying yes, they're interested in that. So I've only got 5 questions for you, so I'm not going to make you work too hard this afternoon at 3:30 in the afternoon. So if you can hang in here, the more we can get in terms of response, of course, that's going to be most useful. And we have got quite a few people on the call. So the more the merrier. And I will leave this poll open so that if you go away and have some thoughts after the call, you're welcome to still go in and add your comments. We'll close tomorrow. So I think we've got a lot of people, and if you're just behind, don't worry, keep entering your response and we'll move on to the next question. So the next question, do you think health and wellbeing should be formally incorporated in transport assessment? Let's see what these results say. I'm very interested always to see if there's somebody who says the opposite. So we've got 16 people who've responded to this question and a few more coming through. Is there anyone out there who disagrees? No, it doesn't look like it. So we've got 20 answers to this one. If you're thinking about, will I respond or not? It's good because these are anonymous, and so we don't know who's saying anything, and you can respond freely. And I will move on because we seem to be about full now. What do you think is the biggest issue in the early delivery of transport options in new suburbs? So this is actually free text. And I encourage you, it takes a little bit more thinking space, I understand, but I encourage you to think about what is that biggest issue and just to type this in as you think of it. You can enter multiple responses if you feel that there's a number of things you want to get in there. So please go for it. These are always interesting to look at. Funding, we all know funding is a big one. And you'll remember that Annette's talked about the paper that's also been produced. It's taken a lot of work, and there's a lot of information in there and different methods of funding that Annette has collated. Okay, existing demand, state government, multi-sector collaboration, delayed response, political will, chicken and egg, housing for garages. Yeah. Demand that doesn't exist yet. Politics is coming up loud. So obviously, as you get more for one particular response, then that gets highlighted in these word clouds. Sequencing is a very big issue. Unrestrained growth. Okay, interesting that people seem to find it easier to even do some of these free text responses. Okay, I'll move on. If you think of more, please keep adding them in there, and remember the poll will stay open. Next one, when sharing research findings, what methods do you find most useful? So obviously this is one that is really relevant to our work. But this is really a communication issue too. in terms of understanding what's happening in research. Think about, what do you like to use? What's the most useful way for you to learn about it? There may be some traditional ways, there may be some new ways, there may be some ways that you've thought of that no one seems to be using. Local evidence. So is that, when we say local evidence, are they case studies, visuals, webinars, infographics? One of the other ways we had been thinking about was even whether it be a very short video or movie, something like that. So please, if you've got more creative ideas, put them in. This is the time to do it. Local evidence, emails with links. And this is the thing, I think it's about how much information at one point of time and what amount of time you've got to look at that. Plain language articles, the conversation, the Mandarin. LinkedIn, short videos, yeah. So these are the sorts of places you're using. Overall responses from the public. I'm not sure who put that one in, but if you can give us some more tips on what you mean. Is that overall responses from public, research groups. Okay. Summaries. Are policy briefs useful to you in your work? Would you use something like that? Statistics, hard stats, mapped. So it's like a range of information, all sorts of different types. Well, if you think of more as you've come away from this, again, remember you can keep adding them in. It's really good to know. Newsletters, so that's what I mean. It really is a combination of old and new versions. So I'll move on to our final question for the day. And the final question today is, after today's session, what topics would you like to learn more about? If you can think about what you've learned so far and what you've heard today, are there things you'd like to know more about?
Oops. I'm in the wrong thing, I apologise. Sorry, just really quickly, I was the one who put in just seeing what the public thought. The reason behind it is that I've found in some jobs that you actually show them all the data you've got, and sometimes the local community can actually provide you with real empirical data which shows, well, yes, no, you're right or you're wrong. And it also, not that it's physical data, it can also help sort of get the mood of the community.
Yes, understood. Yeah. Okay, so application of 20-minute neighbourhoods, regional areas, the data behind it, clear definition of livability, regional areas. So with that clear definition, I'd encourage you go to the auo.org.au website and look under About, and you will find more information that has that definition, which connects up to the literature that is connected to that as well. Application of 20 minutes, clear definition. Livability indicators for regional use. Yes. Regional areas doing well, retrofitting. Okay. So the more you think that you want to know more about, please keep entering those results. Effective advocacy. Yes. How can we help you? I guess is thinking, how can we make the research most useful to you? What can we do differently? How do we support you? I think that's essential. Rather than it just being about us telling, we need to learn to work in partnership together. So at that point, Robin, I might hand back across to you. There's a few more going in. but it might be a nice time to see if this has stimulated any further ideas or questions that people might have.
Thanks a lot, Melanie, and thanks to everybody for.
Well, Robin might have just frozen for a moment. We'll see if she comes back. There you are.
I am back. I have the internet drops out for like 5 seconds at a time, which is very annoying. Maybe 10 seconds. I don't know what you heard me say, but just a wind-up comment, and thank you to you, Melanie, for that. I'm not sure if we've got. There were a few comments going on in the chat, but I'm not sure that there are any questions that we haven't answered. If there are, feel free to raise your hand and actually ask them in person. Annette.
Sorry, I actually had a question to Liam in the chat, so not a question
I was
myself.
just about to read out Liam's, which is a tool that was usable at a stat planning level rather than a strategic for less than 60 lot subdivisions, etc. Is that what you were going to respond to, Annette?
Yeah, well, actually my question was which tool you were referring to, Liam. Were you thinking more of the health impact assessment or actually the urban observatory, or yeah, so what that referred to? Just some more detail. I
was thinking of the health impact assessment. I think I'm not sure that the urban observatory is quite that detailed. I guess we provide a lot of analysis of applications. I'm a strategic planner. We provide a lot of kind of internal referral responses for subdivisions, but we don't always get all of the smaller ones. And I think something which was fairly quick to use, which could provide like a really brief overview of what was important for a particular subdivision, might be quite useful and interesting to have.
Does Lucy want to respond to that?
I do, but the tool itself that we're developing, or the model that we're developing, does tend to, like most models, has some pretty extreme assumptions and limitations inside it to make it functional. One of the key aspects is that it relies on population data and also survey data. So at the moment, what we're drawing on for the physical activity component is the VISTA data, which is the Victorian Integrated Survey of Travel and Activity. And that was for metropolitan Melbourne. It's actually Victoria-wide as well. But the data we're using is from metropolitan Melbourne. So when you're zooming in to look at a very small area, which is what you're suggesting, if you're looking at 60 lots, you kind of have to make this assumption that the whole city would potentially be like that in some ways. You're taking this form and you're using a population that's applied to it. You'd have to understand that any results that come out of a process like that would be subject to those limitations or shortfalls of the modelling process itself. We could certainly feed into that model, as we did with the Altona North and Truganina example, the features of a 60 lot sort of space, if you wish, or the characteristics of it. We could certainly feed that into a modelling paradigm, but it's subject to some limitations. So it's possible to do. And yeah, thank you very much for the comment, and we'll take it on board as well.
Just really quickly, with Vista, because I've used it before, it usually breaks it down into 10,000 lots as the area that it does its agglomeration on, which is why going micro can become difficult if there's not quite density. All the comments that I just put in the meeting chat, and I apologise about that, was that you just have to be really careful with the public transport scores, because I used my suburb as an example. By public transport, I've got absolute great access into the city, Docklands, Southland, Footscray, South Bank and Footscray and those sort of areas. But anywhere else, I have absolutely abysmal connections, and it really requires the use of a car to get anywhere else. Like, for example, for me to go visit family, which are only 20 kilometres away, it's a 15-kilometre, it's a 15-minute car drive, but 2.5 hours by public transport. And when you do those sort of public transport scores, it usually tends to ignore those sort of things. And that's just the risk with having that sort of a model saying, you know, this suburb is fantastic for public transport and connections, but the connections might only be to a very select area.
I was going to suggest or hand it over to Annette for comment on that, because she put in the chat a question to you, James, about whether you knew about SNAMET, and that is an assessment tool which it might be worth.
Yeah, I've seen it. I haven't seen it fully used just because I don't have the license and things like that. But there are tools, and from what I read, like that, which really do sort of help with that. But it's also sort of a true thing in GIS that can help there. So, I mean, that was just one of the things that I knew from previous roles that I've been in could become a very nasty trap. And that's just one thing that obviously with this sort of really wonderful tool, I didn't want to get into that trap.
Yes, thanks, James. And I think, well, I think I'm speaking for Melanie and Lucy as well, that we're quite aware of that in that sense, but sometimes it's also a problem if you can't put everything in. So in that sense, I think especially for the scorecards, so we'll start with, well, at least the bus route should have 20-minute frequencies or something, and that's already something where you look at the qualities. Of course, it's important where those buses go, and we are aware of that, but it's just really sometimes you can't go to that detail, and that's why I mentioned SNAMET, because SNAMET is really looking at the connections between that and the accessibility. So of course it would be great to actually put it all together, but yeah, sometimes it's just not possible. The only thing
I'll say is if you're using a hard cutoff to make frequent infrequent, 20 minutes frequencies are unacceptable. It should be 15 minutes or 10 minutes.
Yep. I think at some point in growth areas you also want to look at being at least a little bit realistic. I don't think we'll get at 10 minutes in, sorry, Truganina, but I think we'll get there very soon. But yeah,
I
take your point.
I mean, I've done work on that in other states where we've actually gotten the government to commit to a 15-minute frequency, and them to actually get it was a bit of a different thing. So I do understand that, but to get a realistic view of good public transport, that's something that needs to be done. And especially if it's going to be used for an advocacy tool, using 20 minutes doesn't really make it effective.
I think I can quickly jump in there as well, just to highlight some of our other work, because what Melanie has been presenting to you, and also a little bit of our work, is with indicator data, it is intentionally high level. It's meant to show that broader picture of what's going on. It's not meant to dig into the detail of the specific journeys that individuals take, and that's really the complexity that you're speaking to. I just wanted to highlight at this point that our project with the Department of Transport is looking at factoring in transit frequency and looking at the health benefits of that, and that is using more complex models. So we're using some of their strategic transport models to dig into that particular question. And with our other project, which is funded by the Australian Prevention Partnership Centre, we're using agent-based models to look at travel behaviour. So that the agents are people, we call them virtual people, and we're able to look at where they start and where they finish and where they stop along the way. And that brings into the specificity of the modelling itself. So I just wanted to add that in there so that you're aware that we're trying to crack that nut, but it's not an easy nut to crack.
Yeah, and to add to that too, Lucy, to go with that, I can see in the chat that there's a lot of interest in the 20-minute neighbourhood, and we've only just been working this year, we've been working on transport to employment. So that's just one very small part of the 20-minute neighbourhood. Well, not a small part, an important part, but the complexity in actually measuring and developing an indicator that's useful and understandable from that has taken a lot of work. So to do that full 20-minute neighbourhood, it's well more complex than it sounds.
Yeah, I do want to say that the work that you guys have done is absolutely phenomenal. I don't mean to be sounding really critical.
No, you're not, James. You're not. You're asking good questions, so don't take it the wrong way.
And I'm happy to talk to you offline if you just want to get some of the things I'm talking about in a bit more detail.
Okay, great. Thanks for that offer, James. And we've got another nice comment from Elizabeth in the chat there. Look, I think we might wind it up with just a few minutes to go. If there's any, I don't think there's any more pressing last minute comments, but it's been great to have so many people engaged with the presentations. I hope you've found them useful. In a lot of ways, as we've said, these are kind of tips of icebergs. There's a lot more work and a lot more things we could talk about in more detail, but hopefully this has given you a bit of a taste of some of the work that we've been doing here at RMIT. And please get in touch. We love to engage with people who might actually find our research useful. So please feel free to get in touch with us to get any more information. So thank you all. Thanks to the presenters and thanks to the engaged audience. And I'll allow you all to sign off now and say goodbye.
Thank you. Thank you for hosting us, Robin.
Pleasure.
Thank you, Robin.
Okay.